Thank you. Well, that was quite impressive reading all that out. Thank you very much. Apologies to only arrive just in time. One of the great things about working virtually is you can be anywhere. One of the bad things about working virtually is you can ask to be anywhere. And I've just finished a session with pharmacy students looking at governance. And I think we'll all agree that I probably should have finished the session on governance with our pharmacy students, who I have to say are excellent. So I'll share my screen with you now, if that's okay. Do let me know in the chat if there is any problem. Hopefully you can see that. So pain and toxicity, I'm going to kind of give a really quick overview of in terms of an area of research. And I'm going to focus kind of partly on the work of somebody called Peter Frost, whose book I thoroughly recommend you take a look at if you're looking for some extra reading. So the necessary pain of organising. Now, I'm biased, of course. I'm a professor of management and organisation, and I run a school of healthcare management. But from my perspective, organisations and organising are the engines for collective progress. That they really are the means by which we mobilise our expertise, our values and resources to achieve that which just cannot be achieved alone. And I think we've really seen this within the COVID-19 pandemic. No matter how brilliant our scientists, how dedicated our individual clinicians, our nurses, our healthcare assistants, nobody can combat a pandemic unless they collaborate, unless they work together, unless there is effective organisation and management. And we have seen, and I'm sat here in the United Kingdom, and so I feel I can talk about that firsthand, but I won't. We can see where organisation and management fails and what the consequences are in terms of public health, in terms of the well-being of individuals, and indeed the well-being of our staff when we don't get things right. So there can be no local or national healthcare or healthcare progress without organisation, management, and learning. So I think that's an inevitable, and I'm sure you all agree. But organisational life and organising can be challenging, difficult, painful, and even destructive. And I suppose the bottom line is, and I've got great colleagues, I should say, but sometimes working with other people can just be hell. It's a really complex thing to do. And this leads to pain. And we can see good evidence of the pain of organising when we just take a really quick look at headlines over the last few years. And these don't necessarily relate to the pandemic. These are broad, but sick and tired while Ireland's nurses are leaving in their droves. Outcry from student midwives over bullying rife in our Irish hospitals. Toxic leadership is becoming an increasingly prevalent in nursing. Toxic cultures affect 1 in 3 midwives, according to top professionals. Employers must stop the rot of the toxic workplace. That last one isn't even healthcare, it's there to illustrate that it's a much wider issue. So these issues of pain and toxicity are ones that have become part of a discourse, part of a conversation about organising and work generally, but increasingly healthcare in particular, and how toxicity and pain may harm not only individual nurses, midwives and public health experts' well-being, but actually our wider healthcare systems and with them our wider populations. Oh, sorry about that, slight glitch. So Frost, who's the person I'm going to talk about in part today, points out that pain is a fact of organisational life. Companies will merge, bosses, and that might be us in some instances, will make unrealistic demands, people will lose their jobs. We will all suffer some negative emotional impact of organisational factors, work factors, of managers and leaders and colleagues who are with us, and also, and I'm not really going to touch on this last bit, of interactions with clients, patients and customers. It can be painful dealing with those that we are here to serve, and actually it can be a privilege to help serve and to work with, but it doesn't stop it being painful. Now, in discussing pain, Frost talks about, and it's a bit of a pun, but 7 deadly INs: intention, incompetence, infidelity, insensitivity, institutional, inevitable, and intrusion. I put this, I'm not expecting us to remember this kind of straight off the bat, but it's useful because it points out the fact there are different ways in which pain might arise or toxicity might arise. And so intention, this is kind of the easiest, isn't it? Purposefully degrading others, bullying is an example. Incompetence, lacking the ability to craft meaningful relations. So and wherever there's a failure in healthcare, you can probably see poor communication being one of the issues listed, or the inability to coordinate or organize services. Infidelity, this one is a tricky one, and I'll talk about this with an example. Erosion of trust or a sense of betrayal. In some systems at the moment where staff have worked very hard under difficult conditions, the failure to keep pay promises is one of those kind of clear betrayals at a kind of national level. Insensitivity, lack of compassion, empathy, or political appreciation. This might be something that we only really get a full grasp of as we continue through organisations, particularly that political aspect. And in terms of how well-being is ignored, or interprofessional power and politics aren't accounted for. We quite often don't see those in basic management courses, but really there is a need to talk about power and politics, particularly when it comes to healthcare, but in all organisations. Institutional policies that hurt or erode confidence. So an example might be poorly run appraisal systems might do that. Inevitability, unintended consequences of change or sudden events. Some health services are much more prone to that. They're continually reformed, particularly those under heavy political leadership might find that each new administration, or even within an administration, brings a whole raft of reforms, and so that can have effects. And then intrusion, work-life balance issues, and then again for many of us that comes back, has been highlighted with COVID-19 and the effect that has had on people's life and their ability to work in different areas. So that's Frost's kind of 7 deadly ins as a way of just kind of categorizing the range of things that might make work painful. Another way of talking about those, so lack of autonomy in a role. Most of us, particularly the more highly skilled, but everybody likes autonomy, but we definitely find those who are really good at what they do. Lack of autonomy can be a source of pain, where you don't get to make decisions or be involved in decision making. Having to take direct orders. I'm an academic. I do struggle with direct orders. That's why I'm an academic. So even if they're the right orders, doesn't mean I won't find it painful being told what to do. Then there are just unpleasant tasks that are just a part of the role that we do, and I imagine there is a number of those in nursing. It's an area I write about as well. In some respects, it's called dirty work, not because it's inherently dirty, but because others might see it that way. Excess work. I talked about unclear communication, mismatched expectations. So we might have a clear idea of what we think people should be doing or achieving, but theirs might be very different, and that might people be above us, below us, or the colleagues that work alongside us, and that can be a source of conflict and pain. And then misaligned or inhuman systems. It might be the way we set up our organizations and how they're organized that fail to recognize that while it might make sense on a spreadsheet or on paper, it doesn't make sense if you're the person who's got to enact it on the ground. Then we've got those kind of more in your face issues. We've got abusive managers, leaders who give free rein to their own emotions, whether that's shouting, demanding, punishing people in public, again, poor communication that others have to try and explain afterwards. Doesn't have to be your boss, doesn't have to be a leader, it might be a bullying co-worker. We see that as well, and the forms of cliques might be another issue. And then more broadly, and there's been a long kind of sociological literature on this, aggressive professional cultures. How do professions relate to each other? Does that vary in different kind of organizational or even national contexts? What is the way in which professions should interact in order to fulfill the promise of multidisciplinary working rather than just the rhetoric of it? So these are all sources of pain. So I thought it might be useful just briefly to give you a case study that I was involved in, which looked at issues of pain. I'm going to call the organisation Health Inc. because that's as bland as I could think of. It is not a directly frontline organisation, but it has a major role in the organisation of healthcare and the delivery of health policy. I'm not going to tell you which country it's in either, and I've worked in a range of countries, so I think that's probably important to say. So it's a particular department in a larger organisation of Health Inc, and they'd got poor staff survey responses, which weren't suggesting it was the greatest place to work, and there was a suggestion of bullying, partly from some of the responses, and it was clear from these staff surveys. So it was a good thing that these staff surveys were there, and they managed to pull out these issues, that the work environment needed improving. So part of the response to that was to call me in to do some research informed workshops, and that's both kind of having them underpinned with research, but me doing research during the workshops to try and understand problems and identify pathways to improvement. So that's what I did. I went in on a number of occasions, and we worked through, I chatted with people, and we worked through the range of issues. Some of the key findings, these are kind of broad findings because obviously I don't want to identify the organisation. Some of the pain that people experienced was, in Frost's terms, inevitable in nature, arising from recent reforms and last-minute demands. Changes in organisational structure had made people really uncertain. It was difficult to know what they were meant to do, and the nature of the work also meant that people were asking things at the last minute all the time, and that caused a great deal of stress. It made work difficult and painful. There was also a lack of information about what was going to be happening next within the organisation and what the future of this particular department was, and that engendered some mistrust, and that was made worse because managers would say, well, I don't know what will happen. Now, that may well have been the case, that the managers didn't know what would happen, but because communication wasn't great, it had the effect of creating a sense of hidden agendas amongst staff and colleagues, where it wasn't clear to them whether the manager really didn't know or just wouldn't tell them, and it was a power issue. Delays in information giving generally within the organisation had the effect of further eroding trust between senior and junior team members. So there's that sense of infidelity, that there might be a betrayal going on, and this led people to question whether they were being valued and whether or not they should stay within the organisation. And the other reason I was brought along is because people had started to exit. The other finding, what was there, is evidence of what Frost calls incompetence in respect of aggressive behaviour and speech. Now, often it was felt it was unintentional, but it was felt that people could be way too assertive in the way they communicated or asked for things, that they could be snappy when they were challenged, and that there were people who always appeared to be angry, and so often their responses were unthinking, or the requests were unclear. There were also just simple things. This is a little bit ironic now, this is post-COVID-19, but an excessive use of email to communicate with each other rather than literally walking to the next desk in the same open plan office and asking people and talking to people about doing things. I guess that's something we're all hoping to get back to, is being able to just walk to a desk rather than email. So you can see there's a range of issues. I've made them slightly blander than they were, but they're important. And while team members understood how such behaviours arose from work pressures, communication styles, tight timescales, and lack of insight on the part of the worker or manager involved, the effect on co-work, and sorry, I've stumbled there. They understood why it happened, but they also went on to say that these kind of behaviours went against codes of conduct. They were counterproductive because people had to take time to make sense of the negative encounter. And the other thing that came up frequent is that people felt it probably wasn't how the manager or leader or the colleague, if it was somebody at their own level, really wanted to be seen. So on all these bases, it was felt to be problematic. The other point that came across was that these behaviours matter because they left people feeling dissatisfied, angry, upset, undervalued, stressed, and isolated. So these are all sources of pain. These are all products of pain. And they increased absence. So in confidence, people were talking about them having duvet days, where they just wouldn't come in, they couldn't face coming in. Increased resistance, where people would just stubbornly refuse to do things, would actively thwart things they were asked to do, and then ultimately they had people exiting. And what was also very clear, and we can see this in the literature, is that higher up the person exhibiting these behaviours is, so the more senior we are, the greater the potential it has to have negative effects. And that relates to the authority and the power, or the perceived power of that person, doesn't it? So this is why managers and leaders have such a kind of responsibility, and a greater responsibility for avoiding pain. So to this point, I've talked about pain. So pain, and this is perhaps a really important thing, is inevitable when it comes to organising and managing. Despite our best efforts, we cannot avoid collaborating and working with others at times being painful. Now, there are aspects of it we can avoid in terms of our aggressive behaviors and so forth, but I know I will ask my colleagues or my staff to do things that they don't really want to do, but we need it done. Pain only becomes toxic when we fail to deal with it or acknowledge it. So, and this is one of the good lessons from Frost. So he says, Frost notes, pain isn't itself toxic. Rather, it's how that pain is handled throughout the organization that determines whether its long-term effects are positive or negative. What turns emotional pain into toxicity, especially in organizational settings, is when others respond to that pain in harmful rather than healing ways. So if we go back to my my example, if you're wondering about the picture, that's Disneyland that set up in Western Superman by Banksy for a short period, kind of dystopian vision of Disney. I thought it kind of fitted with this whole idea of toxicity. At one level, Health Inc. did a good job. They recognized it was pain from their survey and they tried to do something about it. They called in external to tackle it and try and prevent it becoming toxic. But at another really important level, they failed. They accepted all my recommendations and we spoke through them, and I warned them at the time, they did nothing with them. And that was frankly worse than not having me there in the first place. If they'd have done nothing, slowly toxicity would have increased as people got upset about the fact that these issues were never tackled. But bringing me in and then doing nothing made it all the worse because they'd raised expectations of action only then to have them betrayed. So this kind of infidelity issue again, making the situation a lot worse. And what I would see over the coming months, I kept in touch with one of the managers, is the rate of exit from that organization really increased and upticked. And that was a real tragedy. From my perspective, I felt really bad about that because, my aim was to try and help people have a better working life in their jobs. And I didn't have the power or authority to do that. So I was part of an intervention that made that worse. So Frost said the word toxicity may sound overly dramatic applied to aspects of everyday life, but in many ways it's uniquely appropriate. It suggests elements that can poison whether a person or an entire system. Toxins spread, seep, often undetected in varying ways, and toxins the good news is toxins can be eliminated if you know the cure. Signs of toxins, these are things that we might all look for that you might have seen or you might concern yourself with. Absenteeism, declining physical and mental health. I mean, the physical in some ways is easy to see. The mental health, we all know that's a growing issue for our organizations and difficult to tackle. None of these are easy problems. There are no 7 best ways just to tackle these things. Psychological withdrawal, in extreme organizational misbehavior and sabotage. I've seen that. I've worked with somebody who was doing research at a food plant that I can't name, obviously, and they talked about workers who were so unhappy that they would do things to the food that then went out to the public. And this was pre-packaged food, and that was just to get back at an organization they felt powerless against, but they couldn't leave the jobs because they had no other work and there was nowhere else to go to. So we get turnover. There's a really good video online about JetBlue and an airline pilot who abused by travelers, and sick of his employer, stops the plane, and when the plane stops, opens the emergency chute, grabs 2 beers from the fridge. So a degree of style here, goes down the chute and exits the airport. Now, ultimately, he gets arrested, but the reputational damage for JetBlue at the time was quite considerable. So these things matter. Productivity lost, and you can see the other things: fear, silence, failure to recruit. The other thing that can happen is that those exposed to toxicity may become toxic themselves. So actually, they become a further source of pain. So workers that were perfectly good, now, because they're fed up, they're exhausted, they're angry, they become toxic and spread this issue even further. Managers' duty of care. So from my perspective and my research, what are the kind of things that we might do? And I say these aren't quick fixes, but they're things we can look at. And I try to practice, and I dare say I fail on many occasions. We're going to ask people to do things that they don't want to do. One of the things that, and this takes a little bit of time, and sometimes we feel we're too busy, but it's really important to explain our actions and decisions. Why am I asking you to do this? Acknowledging that, it might not be welcome, that they want to do it, but this is what we need to do. Many of us are managers and leaders because we're good at making decisions, and management theory is full of discussions about decision making, but sometimes what we need to do is stop and to listen and to hear the other person's point of view. And we might not even need to give any solutions. All it might be is that we need to hear about the difficulties they're facing, let them talk about them out loud. And it might be that the difficulty is already gone. We just need to acknowledge it, and acknowledging it stops it becoming toxic. And so that could be from formal or informal debriefings. I've worked with Samaritans as an organisation who are excellent at this. Giving people time to regroup and go again, that might be easier said than done in healthcare. And then, of course, the range of systems we might put in place for mental and physical well-being. I think for myself and my colleague, Professor Jenna Ward, we talk about, and others talk about, an ethic of care, and that's recognizing our interdependency. We know in this room that we can't achieve anything without the other people in our organization, and sometimes it's just about kind of acknowledging what everybody contributes at different times. As I said, listening, opening up to other solutions rather than imposing our own. Now, sometimes that means taking suboptimal solutions there and then that you might full well know there's a better way of doing it. But what we might do is stop that sense of disempowerment and help people to learn in their own time, and actually they might become more effective workers in the longer term, and we've avoided pain and causing toxicity. Prioritizing the needs of others, offering support to workers, and support to those who might deal. In every organization, there's normally people who deal with the difficult emotions of others and the toxicity. Looking after those toxic handlers is really important. And then I suppose the final thing I would just add is recognizing difference. And then this is really quite tough. In philosophical terms, it's called radical alterity. And that's just us all appreciating that each of the people we work with are specific and unique and have different needs. And so we might, the solution that's worked for helping somebody through an aspect of organizational pain may not work for another, and we'll need to take a different approach. And again, that all kind of depends on us having the time to do that. So those are kind of some of the issues. How not to deal with pain: ignore it, state that it's just the individual's problem, silence those who question. We know that, and the shutting down of whistleblowers is part of that whole thing. Manage as if emotions should be checked at the door. That's a really kind of classic managerialistic style, because emotions are a core part of organizations. We can't annoy them. And you can see the other things: insensitivity, belittling, blame, things that are really quite obvious. And I suppose that last one, bad apples and isolated cases, at least in Western societies, when things go wrong, and it includes in healthcare, we like to say, well, it was just one bad apple, it was an isolated case. And not just healthcare, the banking crisis that crippled the best part of Europe and threatened to bring down global capitalism, ultimately it was trying to pin it on a few bad apples who were breaking the rules or gambling with the system. It's really not true. While there were bad apples, there were systemic problems that have never been tackled. So I would kind of warn against that. I'm going to stop there pretty much. The other bits that you've got here: openness, transparency, avoiding blame cultures. These are things you will see in almost any report that looks at catastrophic failures in healthcare systems around the world. And I know you'll be well aware of those. So that's my very kind of brief talk there on toxicity. If you're really interested in this as a subject, I would recommend that you look at Theranos as a case in Elizabeth Holmes, a trial that is going on now in terms of narcissistic bullying and deception. If you read through that and just do the opposite pretty much of anything that happened in that organization, you'll probably be doing really well. So thank you very much.
Thank you, Robert. That was great. I have one question, if we could fit it in. To what degree are staff well-being, resilience and coping support interventions helpful when the issue is primarily the organisational toxicity? So
I think we have to be really careful about this, and we've seen this in organisations a lot, including universities, for example, where staff have been under pressure, and we put in systems, we tell people to make sure they have work-life balance, but what we're not doing is addressing the systemic problems that are causing the issues in the first place. There really is no good putting sticking plasters if we're going to keep cutting people with knives. You know, if people are in pain, we should deal with it there and then, but longer term, you've got to look at why our systems are failing. What is it about our organisation and the way we treat individuals that's causing them to struggle with mental health, or is causing them to exit? And if it's not just our organisation, what is it about our healthcare system and the way that we organise it, or that we fund it, or that we structure it, or the expectations that we set? So why quite often are people so abusive on airline flights? It's because for kind of 50 years we sold them a dream of glamour, and that you were always right, and there's consumer sovereignty, and you know, you can have whatever you want. But now we're selling tickets for kind of $9.99 to get you halfway across Europe. Those two things don't go together. So does that answer the question?
Yes, indeed. Yes, thanks. That's great. Yeah, the sticking plaster is a good motto to take away from it. Thank you.
So well, if people have kind of questions or want directing to things, I'm very happy for you to email me at the Royal College, and I'll be more than happy to point to things or answer questions where I can. If I don't know the answers, we can happily look together.
That's lovely. Thank you very much, Robert. Thanks for coming.